Good afternoon, everyone. As said before, Mariekarl Vilceus-Talty from the Partnership of Maternal and Child Health of Northern New Jersey. It is a pleasure for me to be here today and tell you a little bit of what we do at the Partnership for Maternal and Child Health, and specifically what we do in the rural communities. So we are a maternal health consortia licensed by the Department of Health to conduct activities for perinatal and pediatric planning, regional quality of care improvement, and professional and consumer education. So we offer a multitude of social and health programs, and we're dedicated to improving the health and wellness of children and families in Northern New Jersey. So you see here, our commitment is to ensure that all women have access to safe births with the best, most up-to-date medical practices, that we maximize and optimize the health of the family, women, children, fathers, and the community. And all people are, regardless of race or immigration status or ethnicity, will have equitable access to healthcare. So here you see the region that we occupy over. We have 8 regions in Northern New Jersey. We serve 8 counties, and they vary in population, density, and community composition. So within our 8 regions, we have 4 of the largest cities in Northern New Jersey alongside some of the most densely populated locations. So you see here, we have 25 member facilities, 23 of them are member hospitals, and 2 birthing centers. The annual births in New Jersey are about 100,000, of which 50% are within our region. And when we look at the total population, the partnership covers about 4 million people, 4 million residents, and the demographics are slowly changing. And when you look at the breakdown of demographics, we see that the proportion of Hispanic or Latinx and Black residents are slowly increasing. So let's get down to what we're here to talk about today, serving the rural communities. So as you know, we serve the 8 counties in the north, which consist of Morris, Sussex, and Warren, those birthing centers. We work very closely with St. Clair's and Denville, Morristown Medical Center, Chilton, Newton Medical Center, and our birthing center, which is in Morristown. You can see the births there by residents, by counties, but one of the issues that we face in the rural communities is the fact that in Warren County, there is not a birthing center, no birthing institution, which causes quite a bit of an issue for our maternal child population, because once they go over the bridge and they deliver in Pennsylvania, unfortunately, those wraparound services are not effectuated as they should be, because we don't get the referrals back to our counties. So we work really diligently to ensure that that our population, that our residents are educated as to the services that they need to come back to. And that's something that we're working on. One of the things that they miss out with the referrals, not getting the referrals back to us, are specifically the referrals for postpartum depression and anxiety and any other wraparound services. But you can imagine now, specifically talking about mental health, how important it is that the wraparound services for postpartum depression and anxiety is something that we get our referrals back to, because you have the isolation that has happened during COVID. You have the children prior to going back to school, they were at home. So who do you talk to? How do you reach out to the people that need the help if we're not getting those referrals back? So that's something that we're definitely working on with the community to see how we can really effectuate and change that information of not change that situation of not getting those referrals back to us. So we know that there are challenges in the rural communities. Transportation is a huge challenge. And at the partnership, since we are a health and social, we do have many health and social programs, we attempted to look at maybe getting some type of Uber or taxi service to assist our residents, but we found out that it was cost prohibitive. But so we partnered with community organizations, and getting those community organizations at the table, we were able to effectuate the transportation a little better. But that is a huge issue in what we face with the rural health. Access to birthing centers, which we talked about, people going to Pennsylvania to deliver and not having those wraparound services, and just all around limited resources to that particular community. One of the things that we face, one of the challenges that we face, is a lack of trust in the system, especially if you're going to deliver and you're undocumented. And with the increase of Latinx and Black, non-Hispanic people living more in rural communities at a percentage of 11%, with going up 11%, and only a few, maybe 10% of those people saying that they speak and understand English well, it is a very cloistered and close-knit community. So we have to build trust in the system to be able to get those referrals. So once that they are in the program, getting them into the program is challenging, but once they are in the program, there's a very high rate of retention. But even with those challenges, we have quite a few successes. Building those strong community partners, working with our different community partners. We'll talk later about Connecting Dover, who has about 50 to 60 community partners that work with the community, is essential. Being that bridge with the community. So when we get the people into our program, our retention rates are extremely high because it's one person referring another into the program. So that works really well. So when we speak about our programs at the partnership, we do pregnancy support. We have parents as teachers, healthy women, healthy families programs, perinatal addiction programs that help our patients, and of course the emotional well-being support line. Those support groups, because of the transportation and being virtual, are so important to ensuring the health and wellness of the residents that we serve. Some highlights I'd like to share with you is there was a survey done by the National Conference of State Legislators, and they looked at high quality home visitation programs, and it showed extreme positive impacts of reducing incidents of child abuse, neglect, improving birth outcomes, specifically when it comes to low birth weight babies and preterm infants, and improving school readiness is very important, something that happened, and increasing high school graduation rates from others that participated in our programs. So, we support pregnancy throughout the continuum, and we've seen some really positive highlights with that. So when we talk about empowering communities, we know that the lead problem is quite high, especially in Newton and Phillipsburg. But one of the things that has happened is we've had increased lead testing, especially due to our virtual education. We found that the community, very tight-knit, close community, is hungry for education. So once they get into the program, one person speaks to another and they say, hey, come along, listen to what is going on. So they're absolutely hungry for education. And with those 50 to 60 local organizations that we have that share that education, we've seen a lot of teamwork, especially with our parents as teachers program. And it works just really well, specifically in the Warren County agencies. And next, when you look at vaccine education, what we've seen is much higher vaccine rates than pre-pandemic numbers. And that's due to the virtual education and the peer-to-peer counseling that happens within the community. One thing I want to really highlight is the Excellence Family Success Center, which we said before has maybe, I want to say 60 community organizations that they work with. that community center has been a huge success. It's called Connecting Dover when they talk about their CAB, their Community Advisory Board. It's called Connecting Dover, but it should really be called Connecting Morris, because there are so many different different community organizations that lend a hand and lend their services to the families there. And it is really quite a successful family center. They have so many different programs, and most importantly, they listen to the residents, because you can't start and continue to have programs where the residents are not informing, designing, and helping with the implementation of that program. We have to listen to the voice of the consumer. So it has been a true groundbreaking program over there, and we are quite happy with that and look forward to working with more community members. So if you definitely want to work with us, you can just put your name in the chat. pmch.org is the website for the Partnership of Maternal and Child Health. We're definitely looking for partners to ensure that we can optimize the health and wellness of the community members in this area. When we talk about engaging professionals, of course, you saw the list of hospitals that we partner with, and it is really important to us that we engage those rural organizations and hospitals to ensure that our education is seamless and standardized. What's happening in the larger teaching facilities is, of course, brought down, and the providers that work in the area, if they are not affiliated with the hospital, they have the same standard of education. So if you are on the web and the community members, come to the Family Success Center and they're just on the computer, we share the latest trends in healthcare and collaboration. We have over 40 on-demand educational programs that we provide health experts to. We have a wonderful annual conference that we invite the providers and consumers to, because of course we are an educational organization to ensure that the consumers and the community is up to date. So when they go to the hospital for that episodic care, they understand what's happening to them. They understand the questions to ask. They understand their rights, and they're more informed during those episodic episodes that they have with the hospital system. Another thing that we do is we advocate for change, right? Ensuring that there is equitable care for our constituents, to ensure that the voice of the stakeholders are something that is kept top of mind, because we can't do it without the voice of the stakeholders. So to ensure that the legislation and the policies that are being brought down make sure that they keep the rural communities top of mind, and they're not, at the back burner, and it is top of mind, is something that is very important to us. And using the data that we gain, whether it's from the state data from the reporting systems, or the community data that we use when we survey our residents to see what program they would like, what help they need. Can we work with the school system so there's more trust? We bring the children into the conversation to ensure that the families and the community is thriving is extremely important. So the most important part of what we do is definitely building bridges, building collaborations, making sure that the community is part of the education, promoting community health, promoting community education, and working with different community organizations that have their boots on the ground is extremely important to us. So we work as a bridge to the residents. And one of the really exciting things that happens is that we have, here you see just a few of the community volunteers that we have that started with us and love it so much that they bring other people along, and they really inform us as to what is happening in the community, what is needed in the community when programs are working well or not working so well, how we can tweak and change the care and the programs that we're giving. It is extremely important that we thank them and that they continue to spread the word for the 40 different programs that we have for health and social services. So that was just a brief overview of the Partnership for Maternal and Child Health and how we're changing the paradigm in the rural communities.
And thank you, Mariekarl, for providing the overview of the partnership services and all of the services that kind of fall under the partnership's umbrella. Today, I'm just going to spend some time zeroing in on what we're seeing in our immunization programs at the partnership and in New Jersey, and offer some resources for you to utilize when you are informing your patients about immunizations, whether it be annual or COVID vaccination or routine immunizations like HPV. So I have no financial disclosures. So just to remind everyone, the recommended adolescent vaccines are HPV, human papillomavirus, tetanus, diphtheria, and pertussis, which is Tdap, meningococcal conjugate, and then also meningitis B at age 16. And annually, an influenza vaccination and now COVID-19 vaccination as well is recommended for ages 5 and up. So when we talk about adolescent vaccine rates, this is the portfolio that we're looking at to make sure that they're caught up on all of these vaccines. So this chart is a little bit busy, but this is information from the CDC on non-influenza vaccines for children vaccine doses. And Vaccines for Children, for those of you that don't know, is a program that provides free, no-cost vaccines to uninsured or underinsured individuals. So Vaccines for Children, also called VFC sites, are often FQHCs, local health departments, and also pediatric providers, and they provide those no-cost vaccinations for children up to the age of 18. So this report just came out, and it looked at the county level percent change in non-influenza VFC doses ordered June through September 2021 compared with June through September 2017 to 2019. So we're looking at pre-pandemic versus current rates. And we see that there are some target areas where VFC dose ordering, non-influenza, is lower than pre-pandemic time. And some areas to note, some counties that we look at in New Jersey are Cape May, Essex, Hudson, and Monmouth have seen really significant decreases in their non-influenza dose coverage. So those are some areas that we want to highlight for New Jersey. So then when we look at the antigen-specific data, so looking at specific vaccines and where those rates look like now, overall, we're looking at about a 5% reduction in New Jersey of pre-pandemic versus current vaccine coverage rates. And that is consistent with what we're seeing nationally. It's about a 5% decrease. But when you look at specific types of vaccines, especially HPV vaccination, which I'll get into in the next slide, which prevents 6 different types of cancers, we're seeing a significant decrease in New Jersey. So we're actually seeing a 16% difference in pre-pandemic versus current coverage rates in New Jersey. So we really need to think about some targeted ways that we can do some outreach with patients about routine vaccines, checking and assessing if they're up to date, if they have gotten off schedule, and some ways that we can help to get them back on schedule and caught up. So some background on human papillomavirus HPV vaccine. In the US, every year it causes over 33,000 cases of cancer. It is responsible for 6 different types of cancers. And HPV vaccine is an extremely effective vaccine. It can prevent over 90% of those cancers. It has a very great safety profile. It is recommended starting at age 9, and it is FDA approved up to age 45, although we really want children to receive HPV vaccine as soon as they can. So starting to offer it at age 9, because the younger that they start that first dose, the more effective the vaccine is. It's most effective when they are vaccinated prior to being exposed to human papillomavirus. And we know that human papillomavirus, over 90% of the population will be exposed at some point in their lives, and they're exposed through sexual contact, sexual activity. So we really want to encourage our dental professionals to start talking about HPV vaccine in the office, because this is a really important place. Studies have shown that trusted clinicians, when they make a strong recommendation for HPV vaccine, it does increase awareness and it increases vaccine acceptance. And so what we've been doing in the partnership since 2018 is partnering with dental professionals. We started out as a pilot program in Essex County, and we have now expanded it to be offered statewide throughout New Jersey. And we offer education for professionals, parents, and students with support from the White Hill Foundation to increase awareness on HPV as it relates to those 6 different types of cancers, including oral pharyngeal cancer, which is where we really see the connection with our dental professionals in promoting this as a part of good dental health. So this is an example of one of the brochures that we utilize. We've partnered with a nonprofit called Team Maureen. It's based out of Massachusetts. And they actually, we talk about HPV vaccine at the dentist. And we offer training sessions for dental professionals on how to incorporate HPV vaccination assessment and recommendations into their practice. We provide patient education materials that are available in English and Spanish. So this is an example of our a brochure that's translated into Spanish. And those are available in both print and digital download. And then we also provide online and in-person parent and student workshops. So some of our program outcomes, you can see over the last 3 years, we've been able to educate over 1,000 students, over 600 parents, and about 500 dental professionals. And we've distributed almost 13,000 patient education materials. And so year 1, again, was just targeted to Essex County. And then year 2, we expanded to Northern New Jersey, which is the partnership's region. And in year 3, we expanded to statewide. And right now we're continuing to offer this program statewide. And I also want to highlight our collaboration with Zufall Health Center, and Dr. Joaquim and Dr. Ramirez were published in Oral Health and Dental Science in 2020. And they acknowledged the partnership in that article as part of their continuing quality improvement project to increase their HPV vaccination rates. And we had partnered with them to provide education for their staff and to promote HPV vaccine through the Team Maureen materials as well for their patients. So they were able to see an increase in their HPV vaccine rates from 12 to 31%, which was significant. So what we want to highlight is that, HPV vaccination is a part of good oral health. We encourage dental providers to display or distribute printed materials or have them available on their website or social channels. We also, put together social media posts. We have online resources, videos that are targeted at different age groups in both English and Spanish. So we encourage you to share those, display posters in the waiting area or exam rooms, and then also invite your staff to be trained on how to talk about HPV vaccination with patients, as well as invite your patients to participate in virtual or in-person workshops. We're happy to help facilitate those as well. And then if you're using an electronic health record system or you are enrolled in the New Jersey Immunization Information System, we encourage you to use the reminder recall function. And what that does is help you to identify patients who are overdue on vaccines. And you can target then to let them know that they're overdue and either refer them to where they could go get vaccinated, or if you're working within an FQHC, refer them over to the medical side. So those are some strategies. And then last but not least, we have our Protecting the 3+ program. So this is our 10th year of running this contest. It is statewide, and it's available for all New Jersey students, grades 5 through 12. The students go on to the protectingthe3.com website. They're encouraged to pick one of the vaccines that's recommended for them in adolescence, and they create either a poster or a video about that vaccine. And then we acknowledge the winners at a award ceremony in May. So you can look at previous submissions on the website and then encourage adolescents to participate in that as well. It's a fun way for them to learn more about the vaccines that are recommended for them. And we also include COVID-19 as well this year as a category. And this is my contact information if anyone's interested in learning more about any of the resources.
Thank you again for inviting Norwescap and myself to present today. Again, my name is Jessica Dunston, Participant Success Manager. I want to talk to you today, very, very, very brief basic overview of the One Norwescap approach to women and children's health. Again, just a couple notes on myself, BA from Boston College. I am also, what I did not mention, what was not provided previously, is that I am a certified behavioral assistant through the Perform Care system. I am an MSW candidate at Fordham, which was mentioned, and I'm also a full spectrum doula. So there's also that. Who are we? Norwescap is a nonprofit organization providing a comprehensive set of strategies to address the needs of people we serve, including, of course, education, employment, financial capacity building, health and nutrition, housing and community development, and also providing access to volunteerism and community engagement for our residents. And so, this is just a brief overview of what our values are. And you can catch these on our website as well. I'm going to breeze through that part. But with the myriad of programs that we have under Norwescap, we use the One Norwescap approach. And believe me, we service 5 different counties, and we also have senior services in Passaic County, and we're going to continue to grow, of course. So we have many, 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 many programs under all of those counties and under different roofs and facilities for all of those counties, and I'll get to that. But in any case, so our approach at Norwescap, of course, begins with a customer first focus, putting ourselves, the engagement partners, and folks who encounter our families and residents, we call them participants rather than clients or customers. We putting ourselves in our teams in the shoes of the participants is job one when it comes to designing a useful and differentiating participant experience. Of course, we're looking at short and long-term goals. With our participants, we are supporting self-advocacy so that participants can grow in providing self-sufficiency for themselves, and we give them a sense of hope. And so to begin to give you kind of a glimpse into the programs that we have that address maternal and child health, we do serve the 5 counties of Warren, Morris, Hunterdon, Sussex, and Somerset. And as I said, we have additional senior programs in Passaic County with a wide array of programs. And so first and foremost, our approach, again, to echo that, we utilize basic customer service practices and social work skills, including things like, of course, the cornerstone of our work is assessment. motivational interviewing. We designed the participant experience through that type of work and to produce self-sufficiency and improve outcomes among our participants who seek our services. And so again, a glimpse into the services that we provide, beginning with WIC, of course, that is women, infants, and children. Our overall approach, we know that in order to help women and children, we must serve them. So let's take a look at those services. Traditionally, clients would come to our WIC offices in person and receive health screenings with regard to height, weight, hemoglobin, nutrition, and so on, and also eligibility screenings with their various information that could make them eligible for various different types of assistance, public assistance, and plug them into those services as well. So they come into the offices every about 6 months to a year to assess those needs and to assess where they are. During the pandemic, though, WIC provided waivers so that clients don't necessarily need to come in person. So that is where we moved into, and I'll talk a little bit about that later, more technology-driven resources and remote opportunities to provide services and access our services. All screening at this point is still done remotely, using virtual services for the most part, and I'll get into some other strategies that we use. And again, we provide childcare, education, breastfeeding support, nutrition education, things that we're all familiar with that fall under the auspices of what WIC provides. We also, of course, have our Traditions Family Success Center and our Warren County Council for Young Children, FSC, CCYC, and under that program, we have parent volunteer group opportunities. We're building something called, for example, the She Club, for which we are looking for women's health professionals, OBGYNs, and folks of that order to be able to tap into that group and provide those types of supports and education for our participants, because again, this is a parent-led peer support group. So we have opportunities for that among our adult women as well as adolescent girls that we are building. We have community and family fun events, like we had our trunk or treat during the Halloween season. And during these events, of course, we pass out flyers and different types of tools to assist our participants and our clients with being self-sufficient, calendars, flyers, and different types of like pre-made bags with resources in them. So of course, if we have any types of community partners with whom we work that have upcoming like screenings available, vaccine information, we pre-make those bags and we put that information in there. And we also invite community partners to be part of these parts of these events and provide that information. And if need be, and if availability is there, then provide vaccines and things of that order as well. So that's available in terms of health and nutrition. Our Family Success Center has nutrition classes at least twice a year. They work on health and mindfulness monthly through things like yoga and Pilates. Some of those may be peer-led, showing the benefits and the benefits of mindfulness and yoga, things of that order. The parent-ran group does a lot of the health talk, covering mental health, physical health, eating healthy, and then there, of course, are the supplies and nutritious food provided in the Family Success Center. On every Wednesday, there's the healthy meal and stage in a crock pot. So like we actually stage healthy meals to show parents and families the different types of options they may have available with regard to the food pantries. There is an emergency food pantry in the Family Success Center. These are all things that you're familiar with as you have food pantries. And so we have the Strengthening Families program, family to family mentorship program, where there's peer mentorship there. And again, we have parent and child events, because we know that the physical bonding is important for the social emotional learning of children, child development, and healthy attachment styles. Of course, there is no income guideline. And so we're really aiming to remove hesitancy and barriers to access. really, I can say that overall, with regard to our approach toward women and children's health at Norwescap, more than providing services, which of course we do, and providing resources, we focus on removing the barriers to access to resources. And so that is also the aim and focus of our engagement partner program, over which I am the manager. So to just continue with a couple of our programs, of course, we have our Head Start, Early Head Start. And so, you can read on the slide the various types of services that we provide for children from birth to 5 years, children from 3 to 5 years old. They receive screenings based on vision, hearing, eyesight, and so on, which is appropriate for those age milestone markers. We have nurses who are on staff in every county that we serve. We have CNAs available that are available for families at all times. We have teams of healthcare specialists for the baselines of healthcare at those ages. And we also have mental health staff who provide postpartum mental health scales and screenings for moms 6 weeks to 6 months. In addition, we have a wealth of healthcare referrals that are provided, and we have a lot of partnerships with different healthcare providers, literally doctors' offices and so forth in the area. So there's a lot that we do with regard to addressing maternal and child health there. We provide assistance with health insurance enrollment, especially for New Jersey family care, and assistance and support with advocacy and keeping up with appointments, checking in with our participants, with our moms, and with our families, making sure that they actually schedule appointments, make it to the appointments. And then the healthcare, the health status is tracked and monitored from there. And so we also, in addition, provide parenting education that a family might need, and that might include working with any type of significant health concerns, autism spectrum, mental health concerns as well. We do monitor, as you know, child development, and we assess for the appropriate age milestones within the first 45 days of program enrollment. So, these are just the basics of Head Start, Early Head Start. In addition, so we have about 2 more programs to cover. So we have ours. So within Norwescap, we and if and when any of you ever speak to me, I'll just like blow through the acronyms. So I really have to take the time to say them out to you, because we just say, CFRS, and you would know what that is. So Child and Family Resource Service, our CFRS program. Indeed, one of my favorite programs is our child care subsidy provision, in which oftentimes families who may not be able to take part in Head Start, Early Head Start, especially with regard to age ranges, so they are referred to CFRS. And so the philosophy at CFRS and perspective and approach is to meet people where they are. We do not pry necessarily, but we allow the safe space for families to disclose whatever information they feel comfortable in, providing a strengths-based and human rights approach to care. So they can share as much as they like. We provide non-judgmental, neutral, compassionate, affirming, and empathetic service. And so within CFRS, as you can see on the slide provides, we provide the various assessments needed during those milestones of child development, which include, again, child development as well as health. And for whatever concerns there may be, and depending on the age, we may connect them to early intervention. We may connect them to Project Child Find, and we do work with the child study teams within the various public school systems in which we are housed. And so there are also outreach events, family fun events that CFRS hosts 4 times a year. There's the annual outreach event, Books, Balls, and Blocks. And then we also have our team of family engagement specialists and case specialists to which each family is assigned. And so they monitor the assessments, they provide the assessments periodically, at least every 6 months, for the children and families who are enrolled, and they monitor the development progress. And the last two that I'm going to cover is our SEED program, Cancer Education and Early Detection. It's kind of a misnomer, to be honest, because the SEED program actually provides access and initial screenings, and initial annual physical screenings, and physicals for individuals with, a wide range of concerns. And this is not gender specific necessarily. We do provide healthcare services for men as well. However, of course, we're focusing on what we're focusing on today, right? So we provide annual women's health examinations in addition, and referrals. So we do provide and also offer referrals to like your mammograms, your pap smears, your colorectal exams, and so forth, as our age appropriate. And so that is year round. And lastly, our Pathways to Prosperity program assists with providing or with filling out the New Jersey Family Care applications. They identify medical health care providers and create those referrals. And again, same type of advocacy. We check up on the patients and make sure that the connection was made and monitor health progress. We do provide social emotional support, as we know it is very difficult for folks to navigate these types of difficult systems. So we focus on making the channels toward healthcare easier to navigate, increasing accessibility to healthcare in rural communities, always asking, how can these systems coordinate, collaborate, and speak to each other? Hopefully I'll be able to answer some of those questions with working with some of you in the near future. And so we provide vaccine equity advocacy as well. Excuse my chime. And we provide IEP, school district mental health service navigation support, assistance in navigating intrastate health insurance transitions, which some of you may be interested to know, or you may already know, that it is very difficult to, if you're coming from out of state, to transfer over your healthcare coverage. And, basically, sometimes New Jersey health insurance companies, they want you to end your service out of state before they will even go through the process with you here. So these are some of the things and the difficulties that we help individuals to navigate. And we come from, like I said, a social emotional support system with regard to that, understanding how stressful it is for any family or individual to be going through, those types of wait periods, gaps in coverage, gaps in care, and so forth. And we ask, what is the cost of poverty in this? If you have a child who has a need and has to wait more than 6 months for an evaluation, then what type of stress does that cause on the family? What type of exacerbation of symptoms might that cause? And so those are the things that we work toward in our programs. What do we use in terms of tools? Of course, again, we use online screening tools that have been expanded during the COVID-19 pandemic season. Many of our programs, and specifically WIC, we utilize phone calls, text message blasts to our participants, email blasts, newsletters, online client portals. Of course, we have our meetings, webinars, and Zoom. A lot of our programs, especially Head Start, Early Head Start, and Family Success Center, they actually make good headway in the community by simple word of mouth, participant referral between families who already come to see us. And, they bring along their, moms clubs or other friends who are parents and so forth. We also make those community connections. I definitely labor day in and day out to make sure that I make connections with other healthcare providers and service providers, social services, and municipal governments. I am always doing that. Our engagement partners and all of the family engagement specialists through all of our programs are always boots on the ground. We attend any type of be it a festival or any type of effort in public that we can to provide our services, and also to provide a pathway through which individuals in need and organizations in need of that type of access to all of these, community partners that we have and resources that we have, we can enroll folks in our programs and make those connections. And I said before, we pass out those reminder tools whenever we have public events. And so how do our participants feel? Of course, they feel partners in their success. They feel like they've had some part and some stake in improving their own well-being. They feel empowered. Of course, many of our workers here and our engagement specialists are indeed women ourselves. So, and are mothers ourselves. And so we, of course, are able to tap into that type of advocacy and connection with our participants. We are constantly engaging, as I have already explained, and many of our places, especially our Traditions Family Success Center, has become a home away from home for all of those who end up seeking our services. How does it work? Diversity and collaboration. So of course, like I said, always pounding the pavement to strengthen and increase our ledger of community partners. We enter into health service agreements with various organizations. We have agreements with Zufall Health, I know for a fact. Zufall comes through, you see the fan. Zufall comes through for literally all of our programs. I work closely with Zufall with regard to increasing vaccine equity throughout our rural counties and providing boots on the ground with which I'll talk about in a second, providing actual new pop-up events to get more folks vaccinated. Community events like this and like other webinars, we do provide transportation for our participants. We have various ways in which we do that. We have partnerships with folks like Easy Ride and so forth, with whom we can schedule different types of transportation for our participants to make it to doctor's appointments and the like. And like I said, we provide pop-up service sites. So this is literally for all of our programs, WIC especially. We have been moving through our 5 counties throughout the pandemic, providing random and also pre-planned pop-up sites where, we can enroll folks and also provide vaccines and other types of healthcare. And these are just some quick numbers to give you all of the numbers of the women and children and infants that we have served in the past fiscal year. I will not say every single one of them because it's a lot, but like say, for example, WIC itself is over 4,000 women, infants, and children. And so thank you.